My name is Madeline Willis, and I'm a student physical therapist assistant from Jeff State, and today I'm going to talk about Parkinson's disease. I chose this topic because over my clinical experiences this semester, I've gotten to treat several patients with Parkinson's disease. I've grown really close to these patients, and it just really interested me about their disease, so I wanted to learn more about it and share it with you guys. So now we're going to talk about the pathology of Parkinson's disease. Parkinson's is a progressive neurological disorder. It can be inherited, passed down from generations, or it can be sporadic, which means you're the only one in your family that has it. Parkinson's is just a decrease in the dopamine cells in the brain. The cell loss is usually due to the formation of the Lewy body occlusions. So next I just added some cardinal signs of Parkinson's disease. We all should remember these from class, but they are tremor, bradykinesia, rigidity, and postural instability. And I added a picture here. I don't know if you can see it very well, but it's just a perfect demonstration of how patients with Parkinson's disease actually appear to you. So they have this rounded shoulder look, forward trunk. They usually have rigidity or tremors in their head, extremities. They have short steps with their gait. It's really shuffling. Most of the time when they get going, they're going really, really fast, and it's hard for them to stop. That's how one of my patients was that I was treating. So next we're going to talk about the stages of Parkinson's disease. There's 5 different stages. Stage 1, they just have mild symptoms. They usually don't interfere with their daily activity. The tremor and other movement symptoms start to begin just on one side of the patient's body. They'll have a change in posture and a change in their facial expressions. So stage 2, the symptoms are progressively getting worse. The tremor, the rigidity, and other movement symptoms start affecting both sides of the body instead of just one. Walking starts to be a problem, poor posture. These people are still able to live alone, but their daily tasks are starting to get more difficult, and it takes them a long time to finish those tasks. So stage 3 is considered the mid-stage of Parkinson's disease. This is when the loss of balance begins, slowness of movements, they start having more falls. The person is still independent, but their activities are significantly impaired. So next, stage 4, the symptoms are severe and limiting. They can stand without assistance, but they need a walker for ambulation. They're unable to live alone because they're unable to fulfill daily activities. Stage 5 is the most advanced stage. This is when they start to experience stiffness in the legs. It's impossible for them to stand or walk. They require a wheelchair or they are bedridden. These people require around-the-clock nursing care or home health. They may experience hallucinations and even delusions. So next we're just going to talk about some statistics and population affected. It really amazed me how many people actually do have Parkinson's, but 7 to 10 million people worldwide have Parkinson's disease, and approximately 60,000 Americans are diagnosed with Parkinson's each year. So that's a lot of people every year. It's estimated that 4% of people are diagnosed before they're 50 years old, and also men are 1.5 times more likely to actually have Parkinson's than women. So, most of the patients that I treated were men, but it can happen in women too. It's just more likely in men. So, for the medical intervention, I put 2 different ones because there is a new surgery open for these patients. But the first one I want to talk about is just their medication. So we all know there's no cure for Parkinson's, but a lot of the medications help with the symptoms, such as like the tremor and all of that. So we all learned about carbidopa and levodopa. Those are the most effective drugs that deliver dopamine to the brain through the blood-brain barrier. Then we have, they also use other drugs such as the COMT inhibitors, MAO inhibitors, and other dopamine agonists to help treat the symptoms. So next I found a surgical option that is now available for Parkinson's patients. it's called a deep brain stimulation. They implant an electrode in a target area in the brain. It could be both sides or it could just be one. They can do it in different areas or just one area of the brain. And they usually put it in the subthalamic nucleus, but it can be in different areas of the brain as well, like I said. It's good for patients who the medication doesn't really work for. They have the medication-resistant tremors, and also who have patients who have significant motor fluctuations. So nothing is really regulating anything that they have. Okay, next we're going to talk about some physical therapy interventions. So a couple of these I did get to do with my patients. My clinic did not specialize in Parkinson's disease, but we got to treat a couple, like I mentioned earlier, and we used some of these techniques. So the first one is the LSVT big training. This is just using over-exaggerated movements to try to retrain the muscles and slow down the progression of the hypokinesia. So in clinic, it'd be like exaggerating, doing big arm swings, big high steps, different things like that. You can also use a reciprocal pattern, side to side or left to right, patterns such as swinging your arms while you're walking. In clinic, we get them to ride a recumbent bike. That just helps get the reciprocal pattern of moving forward. Also, you do a lot of balance work with these patients. Parkinson's really affects their balance, which really affects their gait. So, as we talked about earlier, they had that short step shuffling gait, and then that kind of offsets their balance because they're not taking proper steps. So we worked a lot with our patient with that. Different activities such as standing on foam, ball tosses on the trampoline, just trying to stand with their feet close together, feet apart. It just kind of depends on the severity of the disease already. All right, so some more stretching and flexibility. These patients really develop tight hip flexors where they have the forward trunk. They have really tight hamstrings and really tight calf muscles. So it's really important to incorporate stretching of all of these muscle groups in your treatment, as well as an at-home exercise program. Okay, and lastly we have strengthening. So muscles weaken with age, as we all know, and most of these patients are already 50 or older when they're diagnosed with Parkinson's disease. So it's really important just to incorporate some strengthening exercises into their daily routine and into their treatment. I also found with treating Parkinson's, the pool is really good for these patients. It helps them kind of relax if they like the water, and then it just helps them to really, they don't have to focus so hard on initiating movements because the water kind of helps them, but also gives them the resistance they need for the strengthening part of it. All right, lastly, just have my references for you guys. If you have any questions, just ask me in the discussion and I'll get back to you as soon as I can. Thank you for watching.